Good afternoon. My name is Fairreia Gipe. I'd like to go ahead and introduce myself. I am a registered dental hygienist. I've been practicing for over 10 years, and I have my master's in public health. And I'd like to thank everyone here for coming today. Today I'm going to be talking about guidelines for hand hygiene in a dental care setting. So let's go ahead and dive right in. Some learning objectives. Today we're going to define hand hygiene and recognize its importance for reducing the risk of healthcare associated infections. We're going to identify the two main types of microorganisms that are located in both the outer surface and the deeper layers within the skin and their functions within the infection transmission process. And lastly, we're going to demonstrate how to properly wash our hands and apply proper hand hygiene within a dental setting. So, with that in mind, what is hand hygiene? Sounds so simple. I know we do it when we are getting ready to go eat or when we're using the restroom, but let's actually define the term. Hand hygiene is a general term that applies to routine hand washing, antiseptic hand wash, or antiseptic hand rub. Now that's with the hand sanitizer. And according to the CDC, we want that hand sanitizer to be 60% alcohol content or higher for it to be effective. Hand hygiene is the single most important measure for reducing the risk of healthcare associated infections, and this is so important. For being a hygienist, you are a front line of defense. Our hands can be deadly weapons, literally. According to the CDC in 2013, there were over 2 million reported cases of healthcare associated infections related to improper hand hygiene. So it's key. Proper hand hygiene involves the use of soap, warm water, rubbing hands together vigorously for 20 seconds. Now I know that sounds like a long time, but when we review the proper techniques to wash our hands, we're going to barely be able to do it in 20 seconds, okay? Hand washing suspends microorganisms and mechanically removes them by rinsing with water. The fundamental principle of hand washing is removal, not killing. So this is important because that is why we routinely wash our hands. We are removing the bacteria. We're not killing it. So hand washing, we need to routinely do it over and over again. Let's talk about the microorganisms on our skin. So in normal skin flora, there's two different types of microorganisms. We have the resident flora, and that's within the deep layers of skin. That's a more permanent flora. If disturbed, they reestablish themselves, and they're not removed by hand washing, and they're usually not associated with the transmission of infection. So just like their name, resident flora, they're in the deep layers of our skin, taking up a residence, okay? Transient flora, on the other hand, is more on the superficial layers of our skin. They are a more temporary flora. So they're here, they're gone. They're the nomads of the microorganisms. They're just the gypsy roamers. They usually do not reestablish themselves, so once they're gone, and they are easily removed by routine hand washing. And this is the microorganisms that are associated with the transmission of infection. So ideally, when we wash our hands, we want to remove the transient flora and reduce the resident flora. So when do we wash our hands? As a hygienist, you need to definitely have this down just like an automatic pilot. You want to begin your day with an antiseptic hand wash for 1 minute, and you want to wash your hands before and after treating each patient, or before you put your gloves on and after removing your gloves. This is so important. In clinic, you're going to get counted off on this, so you need to do this. You need to know this like tying your shoes. After barehanded touching of an inanimate object likely to be contaminated by blood, saliva, or respiratory secretions. This is kind of a given. If you have blood or saliva on your bare hand, you need to go wash it immediately. Before leaving the dental operatory. So this is key, and I've seen this a lot in private practice. You need to remove your gloves and wash your hands once you leave the dental operatory. I've seen dentists who are up at the front desk with their gloves on, or assistants digging through gloves. So you definitely need to keep cross-contamination at a minimum and eliminate it at all costs. So you've got to be mindful of what you are touching with your gloves on. You want to think of your gloves as soiled or dirty. That way you keep it contained in your operatory. When hands are visibly soiled, before regloving, after removing gloves that are torn, cut, or punctured. Obviously, if you're working on a patient and your glove has a hole in it, you want to immediately take your gloves off, rewash your hands, dry them thoroughly, and reglove. So the takeaway there is wash your hands. When in doubt, wash your hands. Wash your hands, wash your hands. Now, how do we properly wash our hands correctly? First of all, you want to make sure that you have removed all your jewelry. Microorganisms are on a higher count when you have artificial nails or polished nails, so it's recommended that we have short, unpolished nails. After removing your jewelry, you want to start with warm water and start with a plain soap for a lather in your palms, and you're going to move to the back of your hands. You're going to intermesh your fingers, and then you're going to move to your knuckles. You're going to get the crevices of your thumbs and the center of your palms, and lastly, you're going to get your wrists. So if you want to break this up in like a camp chant, you can do palms, back of your hands, inner webbing of your fingers, knuckles, crevices of our thumbs, our palms, and lastly our wrists. So we do this because we miss most of those areas if you do a rinse and run. And I know you've seen this in a public restroom where people just put their hands in and they run out. So you definitely want to get the crevices of your thumbs, intermeshing, interwebbing of our fingers, our fingertips. Those are the most highly missed spots. And just as important as washing our hands is thoroughly drying our hands. I can't stress this enough. Once you have washed your hands correctly, you want to get your paper towel from the automatic dispenser, dry your hands, and you're going to use that paper towel to turn the faucet off, or a door handle, or to open a sink to put the trash can in. You're going to use that so you won't recontaminate your hand. So that's just as important as washing our hands. I'd like to thank everyone, and are there any questions? Okay, since there are no questions, I would like to close in saying that we are in a field of prevention for a reason. So instilling good hand washing routine will enable us to be warriors in disease prevention. Thank you so much, guys.